Welcome to your pre-surgery education. You will be working closely with nurses from your surgeon's office, pre-admission testing, and case management to prepare you for your surgery and ensure your optimal recovery. Please have your information packet available to reference during this video. Your role is to educate yourself and prepare yourself as best as possible. Pro tip: we encourage you to contact your medical insurance company prior to surgery. Insurance plans vary, and not all equipment is considered necessary or covered. There may be out-of-pocket costs. Calling ahead will ensure that you are prepared. Preparing your home prior to surgery. It is important to prepare your home for your safety, comfort, and healing. Prior to surgery, your case manager will speak to you about what you may need once you are home. Take the time now to review your home environment and make adjustments so it is easier for you to get around while recovering from surgery. For instance, make clear pathways around furniture and through rooms. Remove tripping hazards such as throw rugs and electrical cords. Add railings to your stairs. Have chairs with armrests available, as that will make it easier for you to get up. Safety in the bathroom is important. Please consider your bathroom setup, including the height of the toilet seat, if there are grab bars, and your general ability to move around. Prior to your surgery, be sure to arrange for your overnight support person. Pro tip: if you will be home alone during the day after surgery, be sure to have easy-to-prepare meals ready. Have on hand things that you could do while you were recovering: books to read, a journal to write in, crossword puzzles, knitting, or another activity to help take your mind off your pain during recovery. Now is the time to update all your providers, especially your dentist, to let them know that you are having a joint replacement. Your providers will need to know about your joint replacement in case they need to prescribe an antibiotic dose prior to future procedures. It is very important not to have any dental work, including cleaning, for 2 weeks before surgery and 3 months after surgery. Your education booklet contains a lot of information on tools and equipment to help you in your recovery. If your joint replacement surgery requires you to have physical therapy after being discharged, your case manager will help walk you through the process. It is helpful to complete this task before surgery to ensure therapists and appointments are available. Physical therapy options could include outpatient therapy, in-home therapy, and then moving to outpatient therapy or completing your therapy at an inpatient rehabilitation facility. This is a flexible plan and customized for you to maximize your recovery. Preparing your body for surgery. Part of preparing for your surgery is a bacterial test via a nasal swab. The test is to see if you have a specific bacteria that can cause an increased risk for developing infection after surgery. You will only be contacted if the result is positive, and if it is, we will treat you. Exercises before surgery, as well as after, are important for your recovery. Now is the time to review and practice the exercises in your book. After surgery, physical and occupational therapists will work with you. We will provide you with antibacterial sponges to wash your body prior to surgery. Please make sure you follow the detailed instructions provided, such as showering at night for 4 consecutive nights and 1 more time the morning of surgery. You will use 1 sponge per shower. Use the sponges only on your body, avoiding eyes, ears, nose, mouth, genitalia. Make sure to have clean sheets on your bed the first night and use a clean towel after each shower. Please do not put lotions or powders on your body, and do not allow pets to sleep with you. It is important that you are as healthy as possible prior to surgery. This can make all the difference in your successful recovery. Here are some things to consider. If you smoke, quit. If you are not feeling well, reach out to your primary care provider and your surgeon. Check for cuts, scrapes, or bug bites that are not healing. And remember, wash your hands often. Pro tip: write down questions so you can ask your case manager or the nurse when you speak with them. Day of your surgery. Your anesthesiologist will speak with you about options for anesthesia, which can differ depending on the type of joint replacement surgery you are having. For example, hip and knee replacements generally have spinal anesthetic. Knee and shoulder replacement patients will also have a nerve block injection. You will be asked to sign a consent for the plan. Once you awaken from your procedure, you should expect some pain, swelling, and bruising. We want to make sure your pain is tolerable, and the nurses will help manage your pain after surgery. Medication management. Medication is an important part of your pain management during recovery. Follow the instructions provided by your surgeon. Medications could include acetaminophen, such as Tylenol, anti-inflammatory medication, narcotic pain medication. Acetaminophen should be taken as directed. Do not exceed recommended daily dose. If you have negative reactions to or are allergic to acetaminophen, please do not take it. Your surgeon may prescribe an anti-inflammatory medication. They are very effective at managing pain and swelling and will decrease your need for narcotic pain medication. Always follow your surgeon's instructions when taking anti-inflammatory medication. If additional pain relief is needed beyond acetaminophen and anti-inflammatories, you may need to take narcotic pain medicine. We want your pain to be manageable, and we need you to be able to rest and practice the exercises given to you by your therapist. Should you need to take the narcotic pain medicine prescribed, please start with a minimal amount recommended. Also, if you are taking pain medication, please make sure you are taking a stool softener, as narcotics may slow your body's digestive system and can cause constipation. If you are prescribed blood-thinning medicine by your surgeon, it is important you take it as prescribed. At home after surgery. Following surgery, you are at an increased risk for developing a blood clot. The first 30 days after surgery is when you are at greatest risk, so you will be required to wear compression stockings or TED hose during the daytime to minimize risk. Moving is helpful in your recovery as well as in managing your pain. Get up and move early and often after your surgery. Maintaining good blood circulation after surgery is very important. Walk around about 1 lap of your home every hour. These 3 exercises, foot pumps, quad sets, and glute sets, will help. Ice is your friend. Use it often, especially after movement and exercises. Place a towel or pillowcase between the ice and your skin for comfort. Once your surgery is complete and you are recovering at home, remember to do the following. Take your medication as prescribed. Work with your therapist as directed. Do your exercises. Walk often, doing laps around your home every hour. Use your adaptive equipment, such as the rolling walker. Wear your compression stockings, TED hose, during the day for 30 days after surgery. Apply ice often, and especially after exercises. By following instructions both before and after surgery, you will improve your overall recovery and recovery time. Thank you for choosing Rutland Regional Medical Center for your medical procedure and for taking the time to view this video. All of us wish you a full and successful recovery.